morning to ladies and gentlemen. I would like to thank the organizing committee for inviting me to give this talk, The Role of Baha Device in Treating Hearing Loss in Chronic Otitis Media Cases. As World Health Organization mentioned in 2018, that around 466 million people worldwide suffer from disabling hearing loss. And with the advances in medicine and technology, this have led us to understand and knew more about the treatment options for all different types and severities of hearing loss. These include hearing aids, medical intervention via prosthesis, or surgically implanted medical devices such as cochlear, middle ear, or bone conduction implants. Majority of patients with moderate to severe hearing loss can be supplied with these conventional hearing aids, but there are some patients who do not benefit enough from hearing aids, or they cannot wear due to anatomical or skin-related issues, and hence implantable hearing devices. Many options, transcutaneous, may be the solutions for adults and children with moderate to severe conductive hearing loss, as well as mixed hearing loss, and also single-sided deafness. What is the impact of unaddressed hearing loss? This will definitely affect the communication and speech, cognition, especially children, education and employment. As in developing countries, children with hearing loss and deafness often do not receive schooling. Adults with hearing loss have a much higher unemployment rate. And those who are unemployed, a higher percentage of people with hearing loss are in the lower grades of employment compared with the general workforce. Social isolation, loneliness, and stigma is also an issue, impact on society and economy. So WHO estimates that unaddressed hearing loss poses an annual global cost of US dollar of almost 100,000 billion. Overwhelming impact globally, if we look at chronic otitis media, it is found that according to WHO, more than 328 million people suffer from chronic otitis media, and about half of this adult with chronic otitis media will develop associated hearing loss. And hence, chronic otitis media may contribute more than half of the global burden of hearing impairment. If we look at the incidence in ASEAN countries, the prevalence rate of chronic otitis media in Singapore, Vietnam, Malaysia, Thailand, Indonesia, that we have and Philippines, you can see prevalence of 2 to 4% considered an unavoidable burden of disease which must be addressed. Prevalence of more than 4% is considered a massive public health problem with urgent attention is needed. And majority of candidates with chronic otitis media related hearing loss are adult. So this is something significant. This is just an example of a clinical case report. Somebody, this is John, who is adult. After 3 failed middle ear surgery, he still couldn't hear, and the hearing loss is so severe that not even a hearing aid seems to help. So chronic hearing loss, chronic ear discharge, bilateral, severe, repeated surgery, and ineffective with conventional hearing aids. These are the cases where we should think about implant device. The hearing loss in patients with chronic otitis media is a significant challenge to treat, which means that the patients may have repeatedly returned to the clinic for help. So in one of the study in 2020, you can see that the patients in Sweden, they have 25% of them have to see their surgeon an average of 20 times and their audiologist 8 times over a 5-year period. And one patient even had the average of 32 clinics visits per year. This is the usual pathway for somebody who has infections of the middle ear and the hearing loss. So they may start from childhood, infected ear, they needed antibiotics, need a ventilation tube, may also need massage surgery. Infection may clear up, but sometimes infection recur and repeated surgery may be needed. And the hearing loss can be mild, can be temporary, but subsequently may become progressive, may become permanent. Improvement may be seen after certain infections has been cleared or certain surgeries. However, in many patients, the chronic issues lead to a permanent hearing loss. And when hearing aids is ineffective after multiple surgeries or multiple infections, I think bone conduction should be considered. Middle ear surgeries for hearing loss not always effective. If you look at the global burden of chronic otitis media, two main things. One is the infection, one is the hearing loss. After mastectomy, infection can be eliminated, but the 2% seems to be remains as residual infections. And the hearing loss associated burden, we can see half of them may have problem, half of them may require tympanoplasty or ossiculoplasty. But when hearing loss remains, this study has showed that almost 11 million of people still living with significant hearing loss. The hearing aids and the cycle of infection. Hearing aids can contribute to a cycle of discharge and infections. Consistent use becomes impossible and leaving the users without the access to reliable hearing. I think you can remember if you have a patient with ear discharge, they can't wear the hearing aids. Or when they wear the hearing aids, it blocks the circulations and ventilations, and the patients have chronic ear discharge again. So patients then cannot wear hearing aids. They go and see the ENT again, need surgery, need antibiotics. So this is like a vicious cycle. Any options other than conventional hearing aids? So I think we should ask ourselves. This is just an example, an overview of bone conduction devices. So we can have a percutaneous or transcutaneous, where you can have Baha Attract and Baha Connect. Surgical Baha implant system. Baha Attract is transcutaneous, where you have an implant and magnet transcutaneously placed, or Baha Connect, where you can still have abutment and it's a percutaneous. So this is based on osseointegration technique. So key indication for Baha is for conductive hearing loss, mixed hearing loss, or single-sided deafness. And we know that Baha was approved in 1996, and also for single-sided deafness in 2002. Bone conduction implant, when we compare to middle ear surgeries, the research have shown that bone conduction implantations may be an effective alternative to treat chronic otitis media related hearing loss versus middle ear reconstructive surgeries for many patients, because nearly 80% of chronic otitis media patients in the national survey report a significant or life-changing effect on hearing after bone conduction implantations. And Baha criteria for conductive hearing loss. Conductive component recommended air bone gap of more than 30 dB, unilateral or bilateral hearing loss, patients who underperform with or cannot wear a conventional hearing aids. For the mixed hearing loss, sensory neural component is mild to moderate, and BC threshold must be better than 65, and the conductive component recommended of air bone gap of more than 30, either unilateral or bilateral. And clients that underperform or cannot wear a conventional hearing aids, we should consider this hearing device using Baha. Comparative benefits of Baha versus hearing aids for mixed hearing loss, as you can see here. As the air bone gap increases, hearing aid performance decreases, so Baha performance is not affected by this factor. The result from the Nijmegen questionnaire also has shown that air conduction hearing aids device preferences is towards the Baha when they have ear infections, and they can actually hear better, especially noise, especially quiet, and the quality of sounds, in fact, is much better. There's one multinational cost consequences analysis of a bone conduction hearing implant system. This was in Italy, if I'm not mistaken. Yes, the conclusion was it has shown that the multinational cost consequence analysis, it can be discerned that healthcare system can achieve a cost saving during the first year that regresses after 3 years by implementing soft tissue preservation surgery with a hearing aid coated abutment in comparison to a conventional treatment. And the cosmetics results are also better. Advantages of Baha for conductive hearing loss and mixed hearing loss. When we compare, what we need to understand is there is a less need for amplifications because of the conductive element. You bypass all the middle ear problems. There's no occlusion effects of the ear canal. It reduces the risk of sound feedback due to the less amplifications. So compared to middle ear surgery, it is more predictable means of restoring hearing, no risk of additional hearing impairment, and there's opportunity to evaluate benefit prior to surgery. You can try. Compared to conventional bone conductors, it is more comfortable solutions, better sound quality, and more aesthetic solution. So this is Baha options. You can see that nowadays there's even a Baha sound arc or softband for children, but Baha sound arc is good. This is on my patient, young boy, but he loves this. This is quite macho and quite nice. And the system of sound processor also have the apps that you can use the apps, iPhone or to Bluetooth that the patient can hear much better. So benefit for Baha implant, I can summarize to say that it's a simple procedure. It is safe. You can have a test rod trial prior to implantations, good and predictable hearing gain, and advancement in technology has improved the sound processor as well. So this is the first sound processor that streams directly from your iPhone. We do have our Baha Attract local study, which was published in end of 2019. In this retrospective study for 4 years, we have patients also have not only microtia, which is a traditional indications, but bilateral chronic conductive hearing loss due to CSOM and single-sided deafness. There's no issue with this Baha Attract, and we achieve a very good functional, mean functional gain. The surgery is very straightforward. As you can see, prepare the site, you measure the thickness, making the incision, raise the periosteum like the usual Baha earlier on for percutaneous implant, drilling, 3 mm and 4 mm, you can proceed and insert the implant, and subsequently you can insert the, this is the implant magnet, and make sure that it is at the flat area, measure the subcutaneous tissue, and you close the skin. This is where 2 weeks and 3 weeks post-surgery. This is a case 1, a 37 years old female, bilateral corneal otitis media, underwent mastectomy and tympanoplasty. As you can see, the right ear here, see the CT scan, and the left ear. So she had bilateral corneal otitis media, underwent tympanoplasty, but the hearing is still very bad for both sides. So she tried hearing aid, she's not happy, the discharge is still there, and she opted for Baha. So our Baha was done, Baha Attract in November 2018, and she's using Baha 5 Superpower, and she's very happy with it, and her aided level, in fact, is very good, average of almost 20, almost normal. So I think that is something good. Another case is a middle-aged man, a male with bilateral chronic discharging ear for many years, waiting for the ear to dry, but further tympanoplasty and mastectomy is also something that sometimes difficult to give you a very good promises that the hearing will improve. So he then used bilateral air conductions hearing aids, bilateral, but it was very difficult because the ear never dry and he can't have a good hearing. So it's a vicious cycle, discharging ear, hearing loss, awaiting surgery, or he should go for hearing rehab first. So after counseling, he opted for Baha implant. He used Baha Connect, the percutaneous type, because it was done before the Baha Attract was launched. So this was in the earlier 2010. And he has better hearing with minimal skin reaction on Baha abutment. Of course, that skin reactions was managed by conservative treatment. So in conclusion, I would like to say that Baha implant has multiple indications. Baha has been proven to be effective in children and adults. It has good hearing rehabilitations for various types of hearing loss, not only traditionally for conductive hearing loss, but also for mixed hearing loss and also single-sided deafness. These include cases that has chronic otitis media in adult or children. It is suitable for many types of pathology, especially when the patient is not suitable with the conventional type of hearing aids due to discharging ears. It is an option. You can actually have the non-surgical type or the surgical type. So you have Baha Attract, Baha Connect, or the Baha Sound Arc or softband. And there is a test rod. There's a trial kits. You can always try before you buy. And this is something that is good for this type of hearing device. And the most important thing is it has a good and predictable hearing outcome. There's no doubt that the hearing outcome is good. It is safe. Surgery is very simple and straightforward with minimal risk or complications. So counseling using the evidence-based outcome that you have in your center or in our center, we have published the Baha outcome in Baha Connect and also for Baha Attract. I think you can have a look, and we are convinced that the outcome of Baha in terms of hearing is good and is a minimal complications. And this also engage audiologists. The current sound processor has multiple, the program that is user-friendly as well. And also you can Bluetooth to your phone. And I think for adult or bigger children, they are very happy as they can enjoy sound much better. So I guess somebody who is not happy because they can't hear well, they have discharging ear in chronic otitis media, make them happy and give the options of Baha implant or Baha device, either Baha Attract or Baha Connect, surgical or non-surgical type. So with that, I thank you for your kind attention.